Okay, so in this video, we're going to talk about another class of antidepressant is monoamine oxidase inhibitors. And as we know, there are like all four classes of antidepressant. So let's talk about the monoamine oxidase inhibitors in this video. What's their mechanism of action? So monoamine oxidase enzymes is responsible for the breakdown of neurotransmitters such as dopamine, norepinephrine, epinephrine, and serotonin in the brain. Let me mention that one. Actually, these neurotransmitters are thought to be a mood stabilizer. So if there is a change in concentration or level of this neurotransmitter in the brain, if their level goes down, then it causes the depression. That's the theory is, because we don't really know what causes depression for sure. They think it's the serotonin is the main one. However, there may be another ones are responsible, such as dopamine, norepinephrine, and epinephrine as well. So let's get back to the monoamine oxidase. So monoamine oxidase enzymes break down these neurotransmitters in the brain. So their level goes down and possibly causes the depression. However, these drugs will work by inhibiting this enzyme. So it will inhibit this enzyme in the brain. When it will inhibit the enzyme in the brain, this enzyme will not be able to break down this good neurotransmitters such as dopamine, serotonin, epinephrine, and norepinephrine. And their level will go up, and that will relieve the depression. That's how it works. Now, these drugs actually increase more than one neurotransmitter level, so they have a really low safety margin because it actually increases the level in the brains. However, when you take a medicine, it's gonna increase. It's gonna work everywhere. It's gonna work in every part of the body, every organ of the body. It's gonna increase the level of norepinephrine and epinephrine in the rest of the body as well. Well, norepinephrine and epinephrine is sympathetic nervous system neurotransmitters, so it will cause the sympathetic nervous-like effect in the rest of the bodies as well. So that is the main reason this medication have a low safety margin and will cause more side effects than any other class of medications. And this medications is usually last resort. Like they try first of all selective serotonin reuptake inhibitors, and then after they will try tricyclic antidepressant, and if it still doesn't relieve the depression in the patient, then they'll try the monoamine oxidase inhibitors, which is the last resort. So let's talk about the side effects. One of the main side effects for this medications is orthostatic hypotension, headache, insomnia, and diarrhea. However, the main thing to look for is hypertensive crisis. This is really, really, really important for the NCLEX, and as a nurse, you need to remember this particular side effect for this medication is it can cause the hypertensive crisis. Whenever you give this medication, monoamine oxidase inhibitors with tyramine containing food, it will cause hypertensive crisis within hours or maybe even faster than that. And the reason that it causes the hypertensive crisis, so we all know the liver is responsible for the metabolism of most of the drugs, and it will make them inactive. Now, when you take a tyramine containing food, this tyramine will suppress the liver, more specifically, it will suppress the enzymes in the liver that are responsible for the breakdown of monoamine oxidase inhibitors medication. So liver will not be able to metabolize these drugs effectively, and they will stay in our body for a longer time and at higher concentration because it was supposed to get metabolized by liver and convert into inactive form, but due to the tyramine, it will not, and it will stay in the body for a longer period and at higher concentration, and that will cause the hypertensive crisis. Now, the signs and symptoms of hypertensive crisis will be a stiff neck, headache, flushing, palpitation, nausea, and if it is not treated on time, it can go into the myocardial infarction and can cause the cerebral bleeding and can cause the stroke, hemorrhagic stroke. If these medications are given with the antihypertensive medication, like any antihypertensive medication like calcium channel blocker, alpha blocker, so those medication, it will cause even more hypotension, and this one can increase the hypoglycemic effect of insulin. So patient on this medication may require a low dose of insulin in order to produce the desired effect, because it will increase the effect of insulin in the body. So you have to keep eye on that one. And also, the thing to remember is, like, whenever you give medication to patient, this antidepressant medication, it will take 2 to 3 weeks to show its effect. And another thing to remember, so like if you stop one class of antidepressant, wait 2 to 3 weeks to start another one. Otherwise, it will cause toxicity and severe side effects. So, like if a patient was on tricyclic antidepressant, for example, and it wasn't working and it was not relieving the depression signs and symptoms, then what they will do, they'll stop the tricyclic antidepressant, wait for 2 to 3 weeks, and then they will start the monoamine oxidase inhibitors. They cannot start right after they stop tricyclic antidepressant or any other class of antidepressant medication. So those are the two other main things to remember, is it will take 2 to 3 weeks to show its effect, and wait 2 to 3 weeks before you start another class of medication and stop one. Okay, this is about the main information about the monoamine oxidase inhibitors. The main thing to remember is tyramine containing food can cause the hypertensive crisis. Really, really important. But if you have any questions regarding these medications, feel free to ask us. Thank you.